Ohio Governor Mike DeWine said that urban areas are seeing a decrease in cases and rural areas are seeing an increase. What do you think is the reason behind the rise in cases in rural Ohio counties?
Again, anecdotally, I'm hearing some discussion from individuals in those counties, maybe face covering use. Again, they didn't experience what we did early on as an urban county. So maybe just some things that we're more prepared at doing or we've been doing has helped us keep some numbers down while they haven't. So I think it might be a combination of a couple different things.
Do you believe enough people in Lucas County are wearing masks when they go out in public?
You know, again, you would always like to see 100% individuals wearing face coverings in public, but I don't know if you're going to ever be able to get that. I do believe that, when we're out and about, whether we're going to the store or out going someplace else in public, I think we're doing a pretty good job of wearing face coverings. I would suggest over 80% of us are, going out and actually utilizing face coverings. I think where we're not realizing we should be wearing a face covering is, going to a neighbor's house and, maybe having a backyard barbecue, where again, we should still be socially distancing, wearing face coverings and doing the things we do when we're out and about in the public. Again, it's really hard too at, weddings. We noticed that we've had some issues at weddings where we've had some cases develop. But again, you're the same thing there. You're not thinking about wearing a face covering, and social distancing probably isn't as good as it should be. So again, it's not just going to the store, being out in public. It really is in those other areas where you're not in your quote unquote family unit, where individuals probably haven't been exposed, either friends or family.
Where else are you seeing the most spread of the virus in the Toledo area?
Again, we're seeing it in the community right now. We're not seeing it really heavily involving the school system. In other words, student-to-student transmission. We're seeing a little bit of that. Hopefully that does keep up, but I don't know if we can, rely on that. We are seeing cases again at the in individuals' backyard gatherings, those special events, whether it be weddings, unfortunately funerals too, those larger events that we're seeing individuals, report that they've been to and could trace back to that. Again, bars and restaurants still are having some issues, and let's face it, that you would kind of maybe expect that because again, you're consuming food, you might be in a more of a crowded bar. And so again, it's really important to make sure that if you're going into a bar or restaurant and it's crowded, you might want to turn around and go find someplace else to eat or to socialize over an adult beverage. So again, those are things that we need to individually take upon ourselves to do.
If someone were to hold an event where they're maybe inviting friends and family, what strategically needs to be done in order to prevent people from getting infected with the virus?
Again, even with these family events, you really want to keep it to the lowest number you possibly can. But again, you still need to take similar precautions that you do when you're out and about. Because again, you don't know if those individuals are infectious, and then you expose individuals, and then that just carries on this issue of COVID-19 in other areas. So again, hand washing, hygiene, sanitizing your hands, face coverings, again, social distancing, 6 foot away. Then that's really hard with some of these events. But again, that's why you have to be very very cognitive of anybody around you could have that disease. So again, doing the same things that you really are in public too.
As you already mentioned, not many schools in the area are reporting new cases of COVID-19. When we look at schools, where are we seeing people getting infected with the virus? Because I know some people have gotten it while they're at school or maybe when they were in the community, but where are we seeing the virus spread?
Again, we're not saying that we're not seeing student transmission. Mainly, again, as we've talked about, what's in the community is going to be reflected in the schools. And so, as we start to see more and more cases in our community, you're probably going to see the same issue or similar issues in the schools, and that's kind of what we're seeing. We're noticing issues on sports teams. So we've had a couple here and there. Again, kids doing something outside, such as maybe going to a Friday night party, and then bringing that into school relative to the infection. So again, we're seeing kind of a mixture, but again, it's mainly centered on things that are happening in the community, and then kids coming to school infected and then exposing possibly other kids.
As of recent, and this has been going on since the start of the pandemic, people have been considering herd immunity as a solution to the pandemic. Do you think herd immunity is a smart way of putting an end to the pandemic, even with the possibility of losing millions of lives?
Herd immunity. If you look at some of the research out there, we're going to need 80% herd immunity, and I think right now we're around 10 maybe percent. Again, that's not updated information, but again, kind of a good idea of where we might be. The issue then is, how do you get to the 80%? Well, you're going to have to again take the chance of infecting a greater chance of infecting those who are immunocompromised or elderly, or in those age brackets that, again, you can have more significant issues. And as we progress to that 80%, what are you going to do with the hospital systems? You're going to start utilizing resources and inundating the systems. And that's kind of where we don't want to go, because again, if those hospital systems are taking care of COVID patients, can they handle the car wreck that, again, if you got individuals in a non-COVID time to the hospital, those individuals could be saved or, helped more. That heart attack, that stroke. I mean, so again, these are all things that go into the equation of how do we reach that 80% herd immunity. Again, you're going to look at a fatality rate that is probably much higher than what we see right now in the course that we're taking.
I know we are entering flu season. So, what is your message to Lucas County residents about the flu, and when and where can people start getting vaccinated for the flu?
So the first message is, if you can get your flu vaccination, get it this year. It's going to help with, again, staving off the flu, but then also too, if you're going to possibly get COVID, you don't want to get flu at the same time. So again, that would be probably a real uphill battle for anybody to combat both viruses at the same time. You can get your flu vaccine, contact your physician, but also too, pharmacies also are giving the flu vaccine. Here at the department, you can look at our website. We have clinics going all the time. You can come in and get your flu vaccine here too.
Would you say so far that enough people are getting the flu vaccine?
I think, we're still kind of early in the season. You would always like to see, long lines at a flu vaccination clinic on a good year. We want to make sure if those long lines, they're socially distanced. So we do want to see people getting a vaccine, and we should be able to try to use every dose of flu vaccine we can in our community.
Do you think we will have a mild flu season because of COVID-19 and the precautions people are already taking?
Interesting. That question was just posed to me the other day, and at that point in time, I haven't seen any research, but there is some idea that maybe the Southern Hemisphere flu season wasn't as bad as it could have been, maybe even non-existent, to tell you the truth. So again, that's just one paper out there. I can't say for sure that that's actually happened yet. But if that's the case, that's good for us. But again, we don't want to rely on that, because again, even though it happened someplace else, it doesn't mean that's going to happen here. So again, I want to bring back the idea of, if you're going to get, if you can get the flu vaccination, go ahead and get it. But also too, the idea of keeping yourself healthy the best you can, so that if we do have a even moderate flu season, we're not having issues combined with COVID-19.
What are your future predictions for Lucas County as far as COVID and the flu, which I know it is still early in flu season, but what are you expecting?
Again, that question is posed to us every year, and that's really hard. With flu season, you're able to really understand per se. And same with COVID. We don't know really what's going to happen, but we kind of months. We know that we're going to be inside more. We're going to be probably in more close proximity to individuals. And so whether it's the flu or COVID or other diseases, it has a greater ability from jumping to person and infecting those individuals than if you would probably if we were, out and about in the summertime, again, going to a picnic where we're socially distanced in open air. It's a lot different than, if we're inside.
Lucas County Health Commissioner Eric Zgodzinski, thank you so much for your time.
Thank you so much, and I appreciate it.